This condition is not just a period problem, it is not just fertility problem, it is not just cyst, it is metabolic and hormonal disorder. It is a warning sign and this matters. Doctors have changed the names of some of the most common diseases in the world. Like PCOS has a new names, NAFLD has a new names, NASH has the new names. The real question is, were we misunderstanding these diseases for years? Because PCOS was never only about the cyst, and fatty liver was never only about the alcohol, and the NASH never just a liver problem. So today I'll explain in a simple language what are the new names, why they were changed, what does it mean for your health, and most importantly, what should you actually do if you have a PCOS, fatty liver, diabetes risk, belly fat or abnormal liver enzymes. So first, understand this clearly. Medicine doesn't change these names for the fun. A disease name changes when the old name becomes incomplete, confusing or misleading. For years, people heard PCOS and thought, oh, cyst in ovaries. Or people heard fatty liver and thought, oh, maybe alcohol problem. People heard NASH and thought only liver inflammation. But today, science is showing something deeper, as many of these conditions are connected to the same root system, to insulin resistance, high visceral fat, hormonal imbalance, poor metabolic health, or chronic inflammation. That means problem is not sitting in only one organ. It is not just ovaries, it is not just liver, it is the whole metabolic system saying something is wrong inside. Now let's start with the PCOS. You guys know, old name is PCOS, polycystic ovarian syndrome. Now they changed with the new name, polyendocrine metabolic ovarian syndrome. Now listen carefully. Old name PCOS made many people focus only on just ovaries and cysts. But here is the problem. Many women with PCOS don't even have an obvious cyst, and many women with a cyst may not have full metabolic condition. So the word polycystic created confusion. A lot of women were told ultrasound to normal hai, so PCOS nahi hai, but their body was still showing the signs: irregular period, facial hair growth, hair falls, weight gain around belly, sugar craving, mood changes, insulin resistance. That is why the new name PMOS is powerful. Polyendocrine means multiple hormonal systems are involved. Metabolic means insulin, glucose, fat storage, and long-term disease risk are involved. Ovarian means ovaries still part of the picture, but not the whole story. So PMOS told the truth better. This condition is not just a period problem, it is not just fertility problem, it is not just cyst, it is metabolic and hormonal disorder. And this matters because when we misunderstand the names, then we misunderstand the whole treatment. If someone thinks PCOS is only just the period problems, they may only focus on the pills. But if we understand the PMOS properly, then treatment becomes more complete. So with the new name, we can focus on nutrition, exercise, sleep, stress control, insulin resistance management, protein intake, fiber intake, weight and waste management, blood test, and hormonal assessments. This is why the name change is not just cosmetic. It can change the way women are diagnosed, educated, and treated. Now ask yourself, if PCOS was never just about the ovaries, then why did we call it for that so long? And the same thing happened with the fatty liver. Now let's talk about the fatty liver. Old name is NAFLD, non-alcoholic fatty liver disease, and the new name is MASLD, Metabolic Dysfunction-Associated Steatotic liver disease. I know the name sound is more complicated, but I will make it simple for you guys. NAFLD means fatty liver that is not due to the alcohol. But that name has a one big weakness. It was defined by the what disease is not, non-alcoholic. And what is it? A liver condition strongly linked with the metabolic dysfunction. That means insulin resistance, high triglyceride, belly fat, high blood pressure, pre-diabetes, type 2 diabetes, obesity, lower HDL, poor metabolic health. So the new name is MASLD is much more accurate. In simple Punjabi language, liver च सिर्फ fat alcohol करके नहीं आती, सगों साडे metabolic dysfunction करके भी आती है. And this is very important for the whole community because many people says that I don't drink alcohol. How did I get the fatty liver? The answer is fatty liver can happen from the metabolic overload with too much sugar, frequent snacking, low protein, low fiber, low muscle mass, insulin resistance and high visceral fat. So your liver becomes like a storage. Or when excess calories keep coming in, then liver starts storing fat. So MASLD is not just a liver name, it is a warning sign. Your liver is telling you your metabolism needs attention. Now come the serious one. Old name NASH and the new name is MASH, Metabolic Dysfunction-Associated Steatohepatitis. Again, remove the word non-alcoholic and focus on the real driver, metabolic dysfunction. MASH means fatty liver has moved into a more inflammatory stage. This is where fat in the liver is not just sitting quietly. Now there is a inflammation, liver cell injury, possibly fibrosis risk in some patients. So if MASLD is early warning signs, it means don't ignore this anymore. And this is why only saying fatty liver is sometimes too casual. Not fear but proper action. Now let's connect all three: PMOS, MASLD or MASH. PMOS affects hormones, ovaries, skin, period, fertility, insulin. MASLD affects liver fat and metabolic risk. MASH affects the liver inflammation and damage. So these are not separate random problems. They may be the different branches of the same roots from the metabolic tree, and that is the message people need to understand. So what should you do if you have PCOS, PMOS, fatty liver, MASLD or MASH? Firstly, don't panic. A name change doesn't mean your disease become more worse. Secondly, don't diagnose yourself from the Instagram or YouTube. Third, lifestyle is not optional. For metabolic condition, lifestyle is the foundation. That is where the clinical nutrition matters. So the next time you hear the new names, PMOS instead of PCOS, MASLD instead of NAFLD, MASH instead of NASH, don't just think naam change kyo hoya. So don't wait until the body screams, start listening when it whispers. If you have a PCOS, fatty liver, high sugar, belly fat or abnormal blood reports, comment metabolic below and I will share what basic steps and nutrition steps you should consider. And if you want a personalized clinical nutrition plan, you can message me directly. This is Jashan, clinical nutritionist. Your body is not just confusing. You just need to understand these signals. Thank you.